Good morning, everybody. Good morning. I'm very grateful to see all of you. I want to introduce the folks who are with us. Dr. Michelle Surgill, who's Director of Cook County Health Simulation. Dr. Thomas Swader, Family Medicine Physician, Cook County Health. Tracy Raschke and Amy Quinn, who are simulation educators. Josh Kim, who's an emergency medical resident, bless you. Serena Valino, who's a nurse manager. All right. Did I get everybody? Didn't forget anyone? Okay, good. And I'd also like to acknowledge and thank David Jones and Walter Matthews, who are doing our sign language interpretation. So thank you. Today, I'd like to show you what it takes to prepare thousands of clinicians, doctors, nurses, technicians, residents, medical students, and first responders to be prepared for critically ill COVID-19 patients. As the busiest Level 1 trauma center and largest emergency department in the Midwest, I'll say that again. We're the busiest Level 1 trauma center and largest emergency department in the Midwest. Cook County Health has been a training center for doctors, nurses, residents, students from hospitals and universities, as well as first responders from the city of Chicago and across the county. The simulation lab at Cook County Health has been teaching best practices for critical and emergency care, not only for our staff, but also for medical institutions and universities around the county. It's mission critical for healthcare workers to be prepared to care for patients coming in who are critically ill due to COVID-19. Dr. Michelle Surgill is Director of the Simulation Center for Cook County Health. The Simulation Lab has played an integral role in preparing all the doctors, nurses, and healthcare workers within Cook County for the COVID-19 battle. It's been critical to ensuring that all clinicians have the skills that they need if they're called upon to work on the critical care units at their hospitals. The Cook County Health Simulation Lab has been training doctors on using ASL 5000 breathing simulator, which is part of the mechanical ventilator Milano project. This project is an international collaboration designed by scientists and engineers whose goal was to develop a low-cost, efficient way to build a ventilator. This ventilator, which is in the final stages of FDA emergency approval, is designed for intensive care units and optimized for COVID-19 patients. Joining me today is Dr. Michelle Surgill, who will talk to us about what it takes to take care of critically ill COVID-19 patients and train critical care staff on the latest techniques and standards for intubating, ventilating, and caring for COVID-19 patients. Also, Dr. Thomas Swader, who has been a family medicine physician at Cook County Health for more than 16 years, will talk about what it's like to be a physician serving in a community health center and what he's done to prepare for service on critical care units. We'll also get to see a critical care training session in the lab. I'm grateful to our healthcare workers for doing what it takes to care for people of Cook County during this pandemic. The ongoing training and care for our patients is a statement to your dedication and hard work. In closing, I'd like to acknowledge that this is National Hospitals Week. We're grateful for our healthcare workers and our hospital staff every day. But this year, recognition comes at a time when our staff is making sacrifices every day to keep our communities safe and healthy. Now, I'd like to bring up Dr. Surgill. Okay. There you go.
Thank you, President Preckwinkle, very, very much. My name is Dr. Michelle Surgill, and I am the Director of the Simulation Center for Cook County Health. Training the world's future clinicians to make critical decisions in difficult situations has been something Cook County Health has prided itself on, and it's that specific training that has become vital during this pandemic. We are now also trying to make sure that staff who must work in our COVID units feel ready and prepared. As you mentioned, starting this week, in addition to ventilator and central line simulations that our teams were already implementing, the Cook County Simulation Center will be using our ASL 5000 breathing simulator to be a part of the mechanical ventilator Milano project. Also, as mentioned, this project is an international collaboration designed by scientists and engineers whose goal was to develop a low-cost and efficient way to build much-needed ventilators. This ventilator, which again is in the final stages of FDA emergency approval, is designed for the ICU and optimized for COVID patients worldwide. Our simulation center at Cook County Health has had to retool how it will train our medical professionals during the COVID-19 pandemic in order to provide the same level of training, but with safe practices of social distancing. We have become very creative in how we can train using social distancing, which is the opposite of what occurs in a typical simulation, where we typically use high-touch technology to push our medical professionals to their limits and provide worst-case scenarios where they have to work together in a small space. That's all for the betterment of the clinical team and ultimately for improved patient safety. During strict social distancing, instead of teams working around our simulators, at the most 4 are allowed in our simulation center at one time. More than that must log onto a conference call and work with educators as they talk through the cases and scenarios. The benefit of these virtual simulations is that it allows these medical professionals to learn the same critical thinking skills and medical decision-making that they would develop normally face-to-face with patients, but in a much safer environment. Due to increased needs that are being seen across the country, Cook County Health is also training family medicine and clinic staff in skills such as intubation and placement of central lines. These clinicians do not typically see critically ill patients, but to ensure that everyone is prepared for the front line, they are receiving the same training as our critical care staff. This pandemic has reinforced the importance of being prepared and ensuring we are all equipped with the knowledge to care for those that need us the most. Thank you for your time.
Dr. Swader, if you would come forward and talk about your experience as a family medicine physician and the new responsibilities you have.
Thank you, President Preckwinkle. I'm Dr. Thomas Swader, and I'm the director of the Family Medicine Inpatient Service for Cook County Health. As a family practitioner, I typically treat patients in the hospital for such problems as heart failure, kidney failure, pneumonia, stroke, heart attacks, and other acute medical problems. The COVID-19 pandemic has pushed all of us in ways that we've never been pushed. As clinicians, it's now more important than ever before to reevaluate our skills, retool, and also learn new processes and procedures so we can provide the safest and best care for those who are infected. Nationwide, there are often more patients who require critical care than there are critical care providers. That's why the simulation lab, under the direction of Dr. Sergel and supported by the leadership of Cook County Health, has been crucial in ensuring that all clinicians have the skills they need if they're called up to serve on the front lines and on the critical care units. Deciding when to intubate a patient is one of many important decisions you must make when treating critical patients. I've been practicing medicine almost 20 years, but I have not intubated a patient since residency. Like most primary care physicians, I just don't have the daily practice of intubating and putting in lines like a critical care physician. But working in the simulation lab, I've developed the confidence and skills for those procedures. Now I can effectively care for patients we are serving during this unprecedented challenge. In a time when our patients need us more than ever, I can now step up and ensure the health and safety of every patient who comes through our doors. To our critical care physicians, nurses, and staff, thank you for applying your skills with steadfast dedication in saving the lives of those who need us most. And to all my colleagues, doctors, nurses, and other professionals throughout our city and country, both on the front lines and in other crucial roles, thank you for your commitment and tireless work serving our fellow citizens during this pandemic. Thank you.
Thank you. Nick, do we have anybody on the line?
We do, from the Tribune.
Except for the fact that I can't understand you, we're glad you're here.
Hello?
All right, yes, hello? Speak louder, please.
Yeah, I was wondering how many people are being trained at the simulation center right now?
All right, the question is how many people are being trained at the simulation center? Dr. Sergel?
Well, that's a complicated question. We've trained over different groups because we don't just train doctors, we train all medical professionals here at the Cook County Simulation Center. There's been 113 nurses that have been prepared for critical care training so that they can go into ICUs and help. There's been over hundreds of people that have been trained using protective equipment, our PPE. We also have had to do, we've had to go into the areas and help pediatrics prepare for serious COVID-related emergencies as well. We call those in situ simulations. So it's the number is, I would say, hundreds.
Thank you.
How long has this?
Sorry, go on.
How long has the simulation center been training people?
Do you want me to continue?
Yeah, go ahead.
Okay. We opened in, I would say it's been about 15 years. I started in the older building, the older nursing building at 1900 West Polk, and when this beautiful building opened, we moved over here. So we've been doing simulations for Cook County Health and hospitals for about almost 15 years now.
I guess my question is, for the COVID-related critical care stuff, how long have you been maybe training nurses and other people who may not interact with critical patients to care for COVID patients?
I see. Well, because of the nice systems integration that we have with our leadership here at County, the minute that this became a nationwide concern, we were asked to jump in and help. So almost immediately, that end of February, early March, when it became nationally recognized that we were all going to have to launch and prepare these medical professionals, that's when we were ready.
What will the final cost of the mechanic ventilator be?
So this is an international project devoted by engineers and scientists throughout the world. They're donating their time to prepare an efficient and low-cost ventilator to help out with the ventilator shortage that we're seeing worldwide. They are a great group of scientists and engineers, and they need a simulation center for their final stages of the FDA. It's been approved, but they need to test it more, and they need a simulation center with a specific a piece of equipment called the ASL 5000. There's very few simulation centers in the city that actually have that, and we are one of them.
Is there a number or estimate on cost?
On cost, no, I have no knowledge on what the cost is.
Do you have any details on what about the technology makes it optimized for COVID patients?
Not at this time. They're starting this week. We've had a lot of great conversations around it. Admittedly, a lot of it might be a little bit above my skill set as an emergency medicine physician. I know about ventilators, but the mechanics and what makes it more optimized for COVID patients has been very plainly explained to me, and it was mentioned that because it does not cause aerosolization as much out into the environment, it was optimized for the COVID positive patients.
Got it. And what countries are the scientists and engineers you're collaborating with from?
I'm sorry, I didn't hear that. Could you repeat that? Oh, what countries? I just know that there are people from across Europe, Sweden, there's multiple people from the United States, Italy, hence the name, and yeah, the list. We can provide a list for you, yeah.
Okay, thank you.
Sure.
And given the latest projections of our peak, how much is the need for ventilators in Cook County?
You know, that changes day by day. And it's not the company or this group that's coming in to test these ventilators is not answering per se a need that we have at county individually, but it's a worldwide need. At county, you know, ICUs are getting very full across the United States. Ours is as well, but they're managing. They're doing a great job. I feel that I'm at one of the better hospitals for disaster preparedness. So I'm proud to say that they are keeping up and doing so in a very organized fashion. To my knowledge, we have not run out of any ventilators.
I guess do you maybe mind talking about what else the county is doing to prepare for this peak? Originally, it was set for, you know, mid-May. Now that's been pushed. What are you doing, you know, to prepare to make sure that you have everything you need should cases spike again or whatever?
You know, that's a little bit out of my skill set. Mine is more into training for critical care. I can tell you that we again are very disaster minded, disaster preparedness minded. So there's a task force that regularly updates us and debriefs us, and there's multiple people that could probably answer that question better. I'm more on the training end of it.
And when do you project FDA approval will be secured?
I didn't hear you. Could you repeat that?
When do you project FDA approval?
I have absolutely no idea. I do know it is very time sensitive, and they're hoping to get this final stage done in the next couple of weeks. So I think that they were mentioning in the next month they're hoping to get it all finalized.
And what is the worst case scenario your simulation center is preparing for?
The worst of the worst. My job is to figure out what our worst nightmares are and to try to figure out how we can deal with them in an organized way so that we are helping with patient outcomes and protecting ourselves. So it's by design an area that we think of the absolute worst case scenarios. Anything, a plane hitting a building, anything and everything, things that make you stay up at night.
Thank you. Those are all my questions.
Thank you.
Hi, Bill Cameron here. I have a question for President Preckwinkle, if you can hear me.
Sure enough.
Sure enough.
Tony, as you know, the governor is under mounting pressure to reopen Illinois quicker. My question is, based upon what you're seeing there at Cook County Health, are his phases at about the right pace, or is he going too slow, or do you think he could go faster?
My understanding is that the governor at his most recent press conference talked about reaching a peak in the state of Illinois in mid-June. I understand that, that we in Cook County might reach our peak a little bit before that, but the governor has to be mindful of the entire state. And I support his efforts to have a gradual reopening of our economy. I think you have to understand that as we open the economy, more people will die. So these are very tough decisions to make.